Back. Right. Sorry, our break was a little bit longer than anticipated. Felt like we needed it though. So we're moving to our committee bill that we heard from various people this morning, and we've made some edits to that, and Legislative Council will walk us through those edits.
Great. Jen Kirby, Legislative Council. So we are looking at draft 3.1. It's on your committee page of the committee bill on the hospital observer. And I have, this is a committee bill, so it doesn't have a number yet. It is 25-0975. But also it means the whole thing is here, so we don't have just an amendment. So the first change is in section 1. This is the language about reduction or reallocation of reimbursement rates when there's a risk to health insurer solvency. And as Emily Brown mentioned this morning, we looked at this again and thought that it was it was not referencing the statute that was actually the one that she wanted it to refer to. So now instead of, these are different event levels that are defined in this part of Title 8 that's referred to here. So a regulatory action level event is different than an authorized control level event. And the reference should be to the regulatory action level event. It has to do with the amount of risk-based capital that the insurer has. So this is again talking about when a domestic health insurer faces an acute and immediate threat to its solvency because its risk-based capital level has triggered, and this would say a regulatory action level event, which I believe is less than 150% pursuant to, and that's the reference to the right section for the regulatory action level event. So that's the first change. The second is, and so as you may remember from this morning, the idea is that the board can reduce an insurer's reimbursement rates to one or more Vermont hospitals when the insurer is at that risk level. And the board shall only order a reduction in the reimbursement rates to a hospital that meets, and now it would be one or both of the following criteria. One is is that the hospital has more than, and this would increase from 125 to 135 days cash on hand and had a positive operating margin in the previous fiscal year. So this putting A and B together with one of the requests from Owen Foster this morning. Or, and now B, the hospital is a member of hospital network that had at the consolidated network level or has more than 100 and again, 135 increased from 125 days cash on hand. And this keeps the or positive operating margin in the fiscal year or both. And we confirmed that that was as intended by the board. So that's that section. Section 2 is the budget review and hospital observer. So no changes here around from this morning around reconciling DBH significant deviations in revenue or adjusting commercial rates to ensure the hospital operates within its budget. But a couple changes here. One of them is the triggers for when the board can appoint an independent observer. So this adds to material misrepresentation that the board may, upon finding that a hospital is materially non-compliant with the budget established by the board pursuant to this section. That would be another instance in which the board could appoint an independent observer. I think that is, oh, right. And then third is the new section 3 that would sunset the observer authority. So 18 VSA 9456 G2, which is that whole piece actually on the authority to appoint an independent hospital observer would be repealed. And I put, there was talk about 5 years. So I put January 1st, 2030. Depends on when this was signed, whether that's a full 5 years. But, you know, we could make it July 1st, 2030 if you prefer, how you want that. But I thought January 1st might be an easy date to keep in mind. And again, that's this whole G2. We're in G here and G2 because it's all in the budget statute. G2A, B, and C are all repealed on that date.
So we're sunsetting the hospital observer.
Yep.
And for 4 years and 8 months, 9 months, that's what they. Does anyone have any questions about the changes? Brian?
It's a very, very specific, not important change to me, but I just wanted to check, okay? It said I'm just going back to it. In section 1, in part C, you could.
Cards, page and line.
Okay, well, it starts on page 2 and goes into page 3, but the specific questions I'll be very specific. Page 3, line 4, it says has more than 135 days cash on hand or had a positive operating margin. However, in the previous section, it's and had a positive.
That's the piece that we confirmed with the board. Yes, that distinction is intended.
That's all. I just wanted to make
Hospital
sure.
is both for a hospital that's a member of a hospital network, either criterion.
Okay, all right, and if that was discussed earlier and I missed it, I'm sorry.
I mentioned it quickly as we went through and may not have been clear, but it was.
Okay,
And we confirmed with the board.
that's all.
that the
Yeah, because I
and
noticed
only
that
applied
difference,
to
that's
that.
all.
Yep.
All right.
Yep. Any other questions about the changes? Any questions or discussion around this committee bill? Yeah, go
If
ahead.
not, I would make a motion. Unless someone else wants to, like if you want to as the chair or something.
I'll start by moving that House Healthcare by straw vote approve the amendments.
This is a committee bill, so it's just gonna be one vote.
Okay,
Well, then I'd like to make a motion that the committee pass this bill out. Whatever draft.
I think you're really gonna, introduce.
I'd like to make a motion that the committee introduce draft request 25-0975 amended.
Just draft.
Okay, draft. I'd like to make a motion that the committee introduce draft request 25-0975 draft 3.1. An act relating to Green Mountain Care Board Authority to adjust the hospital's reimbursement rates and to appoint a hospital observer.
I second.
I wasn't ready to call roll.
Oh.
We still.
Yeah, we can discuss it, yeah.
I wanted to thank everybody. I wanted to thank the committee, in particular. And I want to ensure that I recognize that this is unusual. This is not something that you ever want to do. I understand people's concerns around it. I understand hospitals' concerns around it. But I hope everybody can appreciate what we heard this morning and the situation that we're facing. And if this can help even a little bit, I appreciate everybody and their willingness to do this because it's hard. This is not an easy thing. Alan.
I support this. I just want to remind people this is not a long-term fix. And we as a healthcare committee have some tough decisions to make, and we better be ready to make them. Thanks.
Noted, appreciated, and fully endorse that sentiment. Okay, motion's been made. The clerk can call the roll.
Representative Chino.
Yes.
Representative Cordes, yes. Representative Critchlow.
Yes.
Representative Demar.
Yes.
Representative Goldman.
Yes.
Representative Houghton.
Yes.
Representative Page. Representative Powers.
Yes.
Representative Rebecca.
Yes.
Representative McFawn.
Yes.
Representative Black.
Yes.
Motion passes on a vote of 10-0-1, and Black will be the.
I will report this.
Bill. And.
Yep, so I will email it to you and copy of the drafting operations team and Kristen. And then and I will say in it, please confirm that this is the version you would like to have introduced, and then they will prepare it.
Okay, and then will they send it back to me or will they send it straight to the clerk? That goes to the clerk. Okay, and if I understand, because I did see the clerk today, it's introduced on Tuesday. If the,
Likely.
like,
yes.
if the drafting gets it, it's introduced Tuesday, it has its first read, or it goes on notice on Wednesday. It does not have to come back to the committee. Goes
No,
Wednesday.
I believe you would have a crossover issue. If it needed to go to a money committee, it could go.
So Wednesday is notice, Thursday, second read, Friday.
I believe that's right.
Okay, thank you. Oh, all right. Thank you. Thank you to the committee, and we can go off of live. I think we're